Welcome to Today on this Tuesday morning.
This is Studio 1A. I haven't been here in a while.
Wait a minute. I was going to say so many things are not normal. And in this moment, right now, as I'm looking at you, something finally is. It's good to see your face.
It feels good to be in the same room. I wish we were closer, like we used to snuggle up. But we're practicing our social distancing. It's good to be back in the studio. We have that primetime special tonight on NBC that you and I will host. So we've got a lot of new information and a lot to get to just this morning. Here's the very latest on where things stand. Roughly 3 out of 4 Americans now under orders to stay home. The latest states to join this growing list: Arizona, Maryland, and Virginia, whose stay-at-home order goes to June.
It does. New help has arrived here in Manhattan. The comfort of floating naval hospital sailed past the Statue of Liberty as it entered New York Harbor. It'll be used to lift some of the burden on local healthcare facilities. And check out this powerful sight in New York overnight: the Empire State Building, flashing siren like red to honor emergency responders.
Kind of looks like a heartbeat, too. Meanwhile, Dr. Anthony Fauci, the nation's top infectious disease expert, cautions a second wave of the coronavirus outbreak is likely to come this fall, but he says by then the country should be better equipped to fight the illness.
As we start this morning, there are nearly 164,000 coronavirus cases in the U.S., and more than 3,000 have now died, surpassing the number of people killed in the September 11th attacks. We have in-depth coverage, including a live interview with New York City Mayor Bill de Blasio. But we begin with NBC's Gabe Gutierrez. He's near the USNS Comfort. Gabe, good morning.
Hoda, good morning. This is the USNS Comfort. It's set to start taking in non-coronavirus patients later today. And across town in Central Park, iconic Central Park, an emergency field hospital is also set to open later today. But the lack of hospital bed space is not the only battle that authorities are fighting right now. They're calling in for reinforcements. And we want to warn you, some of the video you're about to see in this story is disturbing.
This morning, a war is raging inside the U.S. epicenter of COVID-19. New York, New Jersey, and Connecticut now topping 85,000 confirmed cases and more than 1,400 deaths.
To me, we're beyond staggering already.
New York Governor Andrew Cuomo is now pleading for healthcare workers around the country to come help.
This is a war.
The Pentagon announcing a New Jersey National Guardsman is now among the dead, while this disturbing video appears to show a body being lifted onto a refrigerated truck outside a hospital in Brooklyn, a grim reminder of what's at stake. But help is arriving. The naval hospital ship, the USNS Comfort, a breathtaking sight next to the Statue of Liberty, even though some onlookers taking it in failed to properly social distance. The 1,000 overflow beds inside are meant to relieve pressure from the strained hospital system on land.
This is the most significant and most important mission I've ever been on in my entire life.
This emergency field hospital in iconic Central Park is set to open today, and now the city plans to build a 350-bed facility at this tennis stadium in Queens on the campus where the U.S. Open is played.
At this point, we assume at least half of all New Yorkers will contract this disease.
But despite assurances by the state and federal government that there's enough personal protective equipment, or PPE, at least for the short term, doctors and nurses on the front lines insist there are spot shortages.
We try to make the best out of very little, and I worry that it's too late for some of us.
Calvin's son is an ER doctor at several hospitals in New York. He says he's having to intubate his own nurses and knows fellow doctors who are on life support.
Every day we wake up, even I do, feeling my head if I have a fever, as if like a soldier were waking up every day to see if they've been shot.
Now, the last time this Navy hospital ship was here in the city was nearly 20 years ago in the aftermath of the 9/11 attacks. On a more hopeful note, Governor Cuomo says that while the number of hospitalizations here in New York continues to climb, the rate of hospitalizations, it's increasing at a slightly lower rate. So that's perhaps some good news. But right now, authorities are analyzing that to see when we might reach that peak. Hoda and Savannah.
All right, Gabe Gutierrez, thank you so much. And as we mentioned, a growing number of states now issued stay-at-home orders in an attempt to control the spread of the virus. One of those states, Maryland, which is where we find NBC's Tom Costello this morning. Tom, good morning to you.
Yeah, good morning. So the next 30 days, according to the Coronavirus Task Force, the next 30 days is going to be critical towards slowing the spread of this and hopefully avoiding a cascade of patients into the nation's ERs and ICUs. Two-thirds of states, now have issued orders for businesses, non-essential businesses, to remain closed. The message, stay home and save lives. Overnight, the U.S. reached a grim milestone. More than 3,000 now dead because of coronavirus. President Trump now focusing on the lives that could be saved.
We could save more than 1 million American lives. The more we dedicate ourselves today, the more quickly we will emerge on the other side of the crisis.
But with no plans for a national quarantine, the response from state to state has varied. On Monday, a coordinated message from the capital region, with the mayor of D.C. and the governors from Maryland and Virginia, each announcing their own stay-at-home orders.
We need to continue to work together to flatten the curve.
No Maryland resident should be leaving their home unless it is for an essential job or for an essential reason.
I'll say it again because I want everyone to hear me. Stay home.
Virginia Governor Ralph Northam's order extending to June 10th, beyond June 1st, when the president hopes the country is back up and running. Meanwhile, a number of private companies are stepping up to help with medical supply shortages, including Ford, which plans to produce 50,000 ventilators in the next 100 days.
It is a slightly different business, but at the end of the day, we're manufacturing and assembling products.
But even as the president announces big numbers and showed off a new rapid coronavirus test from Abbott, a lack of test kits remains a problem in other parts of the country. In a call with governors, first reported by the New York Times and confirmed by NBC News, Montana's governor says without kits from the CDC, his state was just 1 day away from lacking the ability to test. The president appearing to downplay that concern, saying he had not heard about testing in weeks and that the U.S. had tested more people than any other country. It all comes as Dr. Anthony Fauci says the coronavirus will likely be cyclical, with a potential return in the fall.
What we're going through now is going to be more than just lessons learned. It's going to be things that we have available to us that we did not have before.
Yeah, the hope is that by the fall, we'll be further along and have improved testing. Maybe even antiviral treatments will be further along, and vaccine trials, if they are showing promise, they might be able to be used in an emergency situation. Again, we're talking about the fall. As for the current travel restrictions, which are set to expire in just a few weeks, the president is suggesting some of those could also be extended. Savannah?
All right, Tom, thank you. And joining us now to talk more about his city's response to this outbreak is New York City Mayor Bill de Blasio. Mr. Mayor, good morning. It's good to see you.
Good morning.
You've said quite bluntly that the worst is yet to come for New York City and New York State. Can you take us behind the data that leads you to that conclusion?
Savannah, the data is what we're looking at all the time, making our decisions based on. But Savannah, obviously, it means human lives, over 900 lives already lost in New York City. And what we're seeing is a sharp upturn over the last days, certainly the last few weeks. We have to look at this pattern and conclude that the worst is certainly in the next few weeks, minimum. I could see it going into May, in fact, with the numbers we're looking at, because we have community spread. And that's really the issue. It's deeply seated in our communities, and we're going to see this all over the country, unfortunately.
It just has this feel of, it's not the calm before the storm, but, you feel that this is all about to really hit in a huge way when you see something like the U.S. Navy ship Comfort docking off the west side of Manhattan. You see a makeshift field hospital going up in Central Park. Right now, they're empty. But is your expectation that these hospitals will have to be filled with overflow patients because the other hospitals are filled with COVID-19 patients?
Yeah, let me give you the projection, and it's very blunt, Savannah. We have about 20,000 hospital beds in all of New York City. That's where we were, say, the beginning of this month, normal times. We project the potential that all of those beds, all 20,000, will have to be turned into intensive care beds to focus on COVID-19 patients who are really, really sick. That gives you a sense of just how abnormal it could be. Now, I hope the projections don't come true, but we have to, as Dr. Fauci says, you have to plan for the worst. The projection has it getting worse over the next few weeks, potentially extending well into May, and will require a level of hospital capacity we've never seen, we've never even conceived of. We're talking about tripling hospital capacity to be able to handle this.
And Mr. Mayor, correct me if I'm wrong, the last I heard, in New York, you cannot get a COVID-19 test unless you are so sick you have to be in the hospital. So when I read the latest ones I have, say 67,000 cases in New York, doesn't that dramatically undercount the number of people who are sick?
Savannah, absolutely. And community spread, this is what people all over the country have to really feel in their bones. Community spread means it's out there and it continues to grow. And there's a point where it stops, like every other seasonal disease. Well, there is an end point here. But for the weeks ahead, let's not kid ourselves. It gets a lot worse before it gets better.
Can we talk about this issue of testing? I just mentioned that in New York, in order to conserve testing capacity, only the hospitalized are getting these tests. The president was on a call with governors yesterday. He was one of the governors from Montana mentioned that state's need for tests. He said he hadn't heard about testing in a few weeks. Is testing still an issue here in New York?
Testing at this point, if testing had come earlier, I asked for testing from the federal government originally on January 24th. If we had gotten it in January, in February, beginning of February, we could have gotten ahead of this. I think there are still states where they can, and getting them testing is crucial. What it means now is it's the way we determine who needs the most immediate urgent care. It's a way we help to protect our first responders and decide, of course, who needs to go and be isolated. But I think the fact is testing is going to play a different role now. If we could get rapid testing on a truly universal level, that could help us a lot. That could help us immediately tell people what they had to do. But the best kind of testing is the testing early before you get an outbreak. Some states could still benefit from that.
Couple quick things. I mentioned the U.S. Navy ship Comfort has now come to Manhattan. I'm sure you saw these sites yesterday where many people wanted to get a glimpse, and some of the images indicated that people weren't really keeping that social distance as they crammed in to get a shot. What's your message to folks who may have done that here in our city?
Yeah, that's unacceptable. Savannah, look, we all feel a lot emotionally about the arrival of the Comfort. It's giving us so much hope that our military is here, and we're going to need a lot more military presence. We're going to need a lot more help from the federal government, including medical personnel from the military, very, very quickly. I've told that to President Trump. We need folks by Sunday, starting this Sunday, to get ahead of that horrible onslaught we expect in the next week or two. But in the meantime, as much as we love the Comfort and we love the fact the military is here, people must practice social distancing. And I've authorized our police to start giving out fines, $250, $500 fines, to people who don't get it. Because at this point, we've said it, we've educated, we've given people the message. Anyone who's not social distancing at this point actually is putting other people in danger. And if we have to give them fines, we will.
All right. New York City Mayor Bill de Blasio, thank you for your time, sir, this morning. We really appreciate it.
Thank you, Savannah.
And, of course, New York has put out the call for healthcare workers from around the country to come and help out. And just ahead, we are actually going to focus on some of those people who have answered that call a little bit later in the show. Hold on.
While doctors are being overwhelmed by COVID-19 each day, they're also learning more about the virus and how to fight it. For more on that, we're turning to NBC medical correspondent Dr. John Torres. Dr. John, good to see you. So we're going to begin with this thing we're calling the Great Mask Debate. The president said yesterday that he could actually see a scenario where every American maybe should be wearing a mask, but that's really contrary to what the CDC said, because we've been saying for weeks on this show and many shows, like, not really necessary. So what's the right answer here?
And Hoda, you're right. This is the great mask debate, because it actually started this weekend with a doctor tweeting out that the CDC was going to change their guidelines and say people should be wearing them when they're out and about. I talked with the CDC yesterday. They said they have no plans to change their guidelines. Their guidelines are still what they've recommended, that people in the general public shouldn't be wearing them. A lot of experts are saying, yeah, it might help out a little bit. Why don't we wear them? Well, the truth is it actually might help out a little bit, but here's the caveats behind that. People have to wear them constantly. They have to wear them correctly, and they always forget, too, that their eyes are another other way the virus can get in. So without eye shields, they're not getting all the protection they need to get. Might give them a false sense of security, so they might get inside that 6-foot bubble that we're putting around ourselves to keep away from the virus. If they do and somebody coughs or sneezes, they're still vulnerable to it. So that's one thing. On top of that, they're trying to protect the actual masks, the surgical masks, the N95 for frontline workers because they definitely need them. Yeah. But as to whether it'll help out or not, is the CDC going to change its guidance and say so? Right now they're saying no. Could it potentially help? It could, but it's not going to give you full protection, and it's not going to give you any more protection than washing your hands and definitely keeping that 6-foot distance.
Yeah, and even if you did it at the CDC, I mean, the idea would be to do a bandana or something, not to use these surgical masks or the N95 masks that are so desperately needed by our frontline healthcare workers. Let me ask you another thing, Dr. Torres. There was a new study, a small one, but it suggested that transmission of COVID-19 can still occur even after someone's symptoms have subsided. Well, this is obviously quite disturbing, but I know it was a small study. What do you make of it?
So it was a very small study, Savannah. It was 16 patients, and they found out that half of them had symptoms and could actually give the virus to somebody else even days later, beyond that 3-day time period we talk about. But one thing, if you look at the study, these were patients with severe complications and severe symptoms who were in the hospital. And so it looks like with the mild and moderate cases, which the vast majority of people who have coronavirus have, it looks like that 3-day time period still holds. That's the time they need to make sure they're not spreading to anybody else once the symptoms go away, including fevers. But for people that are hospitalized, it might take a little bit longer. And this is where the doctors come into play. And somebody, when they're hospitalized and they finally get released from the hospital, the doctors need to sit down with them and say, here's how long you need to stay in isolation at home. Even though we're letting you out of the hospital, you might want to stick around your house a little bit longer to make sure it doesn't spread. But again, remember, a very small study, very limited number of people, and these were people with severe symptoms that looked like they could spread it for longer periods of time.
Dr. Torres, you've been talking to us over the weeks about viral load. I guess it's how much of the virus you are exposed to and how that can affect how sick you get. Tell us about that.
So exactly right, Hoda. Viral load is the amount of virus that first gets into your body when you start getting sick. If you get a little bit of virus, you're only going to get a little sick. If you get a big viral load, in other words, you're sitting next to somebody for long periods of time and that virus just keeps hitting you, you're going to get more sick. And those are the ones that tend to get the severe complications and the severe symptoms based on this. And that's why frontline workers are so exposed, and we keep talking about saving masks and equipment for them because they're constantly near somebody. They're getting that huge viral load. It gets to a point where your body's immune system can't handle that overload of virus, and that's why we are so concerned about people getting a huge viral load up front, because if they just get that small one, they won't get as sick, and it's important to make sure that people obviously don't get that sick and recover from this as quickly as possible.
All right, Dr. Torres, thank you. As always, good to see you. We want to encourage folks to join us tonight. Hoda and I are hosting a special primetime show about the pandemic. This is the first in a series NBC News will be doing in the weeks ahead. We're going to examine the outbreak's toll, the country's potential new hotspots, and answer your questions. It's tonight, 10 Eastern and Pacific, here on NBC. You could also find it on MSNBC and our online streaming network, NBC News Now.
All right, what do you say, both of us? Say hello to Mr.
Good
Roker.
morning,
Al. Look who's here.
Well, all is right with the world. You guys are back together again. It's like reunited. I hear peaches and herb. In the
It feels good, too.
Fantastic.
Yeah.
Well, guys, it does. It looks good, that's for sure. Unfortunately, the weather doesn't look good for our friends down to the southeast. We've got some severe weather. In fact, some severe thunderstorm warnings out through central Mississippi. This is all pushing to the east as the day wears on. We've got a risk for severe weather through there into Georgia and on into parts of South Carolina for hail, possibility of tornadoes as this pushes in. Heaviest rain will be for the Outer Banks. Wind advisories from Mississippi down on into Florida, and then low pressure deepening offshore with a rough surf along with a minor beach erosion. Rainfall amounts, we're talking heaviest around the Carolinas with locally up to 2 inches of rain, but still we're going to keep an eye out for some flash flooding.